Hello guys, welcome back to Clinically Clear. Today let's cover a few international health organizations. Let's start with World Health Organization or WHO. It was founded by the United Nations on 7th April of 1948. That is the reason why we celebrate World Health Day on 7th April. Organization mainly it has three components: the World Health Assembly, the Secretariat, and the executive body. The superior governing body is the World Health Assembly. It is basically a meeting which happens once a year in May, where all the member countries they send their representatives, health representatives, for a meeting once a year in May, known as World Health Assembly. What do? They elect the executive body. They formulate and they provide the international health policy for the year. They review the yearly process and they give the annual budget. This is the function of the World Health Assembly. It is the superior governing body. The Secretariat is just the administrative division which does all the managerial work and the administrative work. The executive body consists of 34 health experts from various countries. The health experts are not representing their country here, they are just a part of this executive body. Two-thirds of this every year, one-third membership of this executive body gets renewed and two-thirds will get freshly elected. Freshly elected by whom? By the World Health Assembly. Understood? This executive body is the one that is responsible for the actual implementation of the policies and the programs by WHO. And they meet twice a year in both Jan and May. Understood? So you have World Health Assembly, superior governing body, elects the executive body, 34 experts. Secretariat is the administrative division. All the work is done by the executive body. Now you just can't have one office, right? The world is huge. So you need 6 regional offices with regional directors heading each of the offices. So in Southeast Asia region, you have Delhi as the head office. Americas, North and South America, you have Washington. Africa, you have Brazzaville in Congo. European region, you have Copenhagen, Denmark. Eastern Mediterranean region, you have Cairo in Egypt. And Western Pacific, you have Manila, which is in Philippines. Okay, so 6 regions and 6 regional offices with regional directors responsible for the implementation of policies in these 6 regions. Understood? The functions of WHO are very basic. One of them is what? Of course, prevention and control of diseases. How do they do it? They give international health regulations like quarantine policies, how many days you should quarantine, what is the travel quarantine duration to prevent spread of diseases from country to country. They do epidemiological studies, epidemiological surveillance of disease. They emphasize upon immunization to prevent the diseases. And most importantly, they keep a worldwide surveillance on a few communicable diseases like rabies, TB, malaria, HIV, which are of public health importance. So these are all this is the first function, prevention and control of specific diseases. Then, of course, they try to improve family health. They focus on family quality and family health quality. Then environmental health is in the form of WHO Environment Health Monitoring Program. Basically, this program monitors on air quality, water quality, food quality, environmental sanitation, and various other environmental parameters with respect to health. So, family health and environmental health. WHO provides a uniform procedure, a systematic way to collect, analyze, and report health and medical and vital statistics, biomedical statistics. The way to report it and the way to collect it is given by WHO. They promote health research. How? By having a worldwide network of research centers and by giving research grants and fellowships to the researchers. To anyone who is interested in doing research, they can apply for grants and fellowships from WHO. So this is the way to promote health-related research. And this research has to be published, right? It is published in health literature. So they provide health literature. Which are the health literatures? There are many different WHO related. WHO Chronicle, WHO Bulletin, the WHO website, www.who.international, whatever it is, and WHO Health Statistics Report. So these are all some examples of literature that is provided, health related literature provided by WHO. And they also focus on multi-sectoral coordination, like coordinating with UNICEF, coordinating with FAO. What is FAO? Food and Agricultural, it's actually Food and Agriculture Association. I'll come to it later. Okay. So Food and Agriculture Association or organization, Food Agriculture Organization actually, my bad, not association, Food and Agricultural Organization. So basically FAO, it was in Rome. Here FAO was mainly focused on food quality and food production, improving food quality, production and consumption. Okay. So this is about WHO. So you have various functions: prevention and control of diseases, family health, environmental health, health statistics, health research, health literature, and multi-sectoral coordination. Now, Rockefeller Foundation, it is an NGO founded by someone known as John Rockefeller in the early 1900s. It is a non-governmental organization. It is purely philanthropic. In India specifically, they assisted in the establishment of various medical colleges like AIMS in Delhi, SGS Mumbai, King George Medical College Lucknow, CMC Vellore. All this in the establishment, they gave monetary support. They gave travel grants to Indian healthcare specialists to go abroad and to learn more, to get educated more, and sponsored visits of healthcare specialists from USA. So health specialists from USA were sponsored to come and to teach Indians. So this was also sponsored by the Rockefeller Foundation. Understood? Red Cross Society, we all know, International Red Cross Society, mainly concerned with it started off as war-related injuries and to treat war veterans, but now it is mainly concerned with emergency medical care. In India, the headquarters for Red Cross Society is in Bengaluru, and worldwide it was in Geneva, started in Geneva. Red Cross Society. Now coming to the next important one, that is UNICEF. United Nations International Children's Emergency Fund. Okay. This was also started in 1946 by United Nations. The headquarters for UNICEF is in New York. The aim is, it is everything concerned with children. Holistic health in children. The aim of UNICEF is holistic health in children. The mnemonic for the functions is GOBI triple F. G-O-B, GOBI triple F. Understood? So let's start with G. G is growth charts. Obviously, growth monitoring of children. All that is done through growth charts. ORS. ORS for mild and moderate dehydration. B. Breastfeeding related promotion. Breastfeeding education and promotion. UNICEF gave something known as Baby Friendly Hospital Initiative. BFHI. This Baby Friendly Hospital Initiative. For a hospital to be certified as baby friendly, there has to be 10 steps. First of all, there has to be code and policy. Breastfeeding guidelines, breastfeeding policies in that hospital regarding how to initiate, how to support, how to counsel regarding breastfeeding. The staff in the hospital have to be trained. The nurses have to be trained. The doctors have to be trained on how to promote, counsel, educate, and initiate breastfeeding. Understood? Pregnant women, before delivery itself, you have to start breastfeeding education, antenatal breastfeeding education. And within 1 hour of delivery, immediate skin-to-skin contact to prevent breastfeeding and support, give support to the mother who has just delivered to initiate breastfeeding if needed. Understood? So as soon as the baby is born, we want to start breastfeeding. Artificial feeds only if indicated, and mother has to do demand-based feeding. Every time the child demands, the mother has to respond. It's known as responsive feeding, demand-based feeding or responsive feeding. No bottle feeding, no artificial bottle, nipple feeding, no bottle feeding, no teat feeding, nothing like that. Rooming in of the baby with the mother to promote breastfeeding. And when you're going to discharge the mother, you have to give all the breastfeeding education, counseling. And you can also refer the mother to some breastfeeding support groups if needed during discharge. Understood? So these 10 steps are absolutely necessary for certifying a hospital as baby-friendly hospital. Baby-friendly hospital initiative is concerned with breastfeeding. Understood? I for immunization. So basically UNICEF gave money for the production of vaccines, for the production of sera in India. UNICEF gave monetary support to India's BCG immunization program. So basically everything regarding promotion of immunization. F for family welfare, F for female literacy, and the last F for food supplementation. So food supplementation, basically child nutrition. UNICEF collaborated with food agricultural organization and applied and came up with something known as applied nutrition program. So basically what is this applied nutrition program? It has special emphasis. The highest priority of this program is child nutrition. And before, the UNICEF also used to fund midday meal scheme in India, and UNICEF developed a low cost high protein mixture, once again for improving child nutrition. So these are all some of the functions of UNICEF: growth charts, ORS, breastfeeding, immunization, family welfare, female literacy, and food supplementation. That's it regarding international health organizations. Thank you for watching.